Hello, Dr. Dave Webster again, and I tried to get this video out a couple of weeks ago, but my work schedule has been, to put it mildly, busy. Last couple of days, for example, I've been working 13 to 15-hour days, and this is quite routine for me in working, for example, assisting in the OR on the weekends. So I'm going to do my best to keep the videos coming, and I promise to make them shorter, so yeah, the checks in the mail. I also apologize for not getting back to people on my social media sites. I mean, as you can see, I just don't have the time at the moment. I'm going to get to it eventually, hopefully. But this is part of a series of videos I'm releasing about my upcoming, so we say, attitude adjustment or gagging me by the College of Physicians and Surgeons of Ontario for daring to challenge that the Ontario governments defend why they have been using clearly unethical and bordering on immoral experiments on patients to determine whether pets funded or not. Now, I hope you're shocked by the ruling against me, but not for my sake. I want you to be shocked because of the profound and serious implications this has for you and your family. And I'm mostly going to be talking about PET scanning, but what you need to, and PET scanning, by the way, has been the world standard of imaging management of cancer, and of course, as you will see, other diseases for now 20 years. But PET scanning is just the most egregious example of how politicized the process is of making decisions that impact you and your family, as you will see. So I think to try and help you understand that, I think it's worth going over a little bit of just review about what PET is, and this I believe will be helpful. Now, the critical factor or number to remember in your mind is that if you do get cancer in Ontario and you do not have proper access to PET, what it will mean for you is this: you will actually have an approximately 40% chance on average of getting the wrong staging for your cancer. This will translate to increased exposure to unnecessary, potentially high-risk investigations and a gross overexposure to useless CT radiation, which is harmful to you, and of course, potentially the wrong treatment for your cancer. I've also said before that Ontario patients have the least number of PET scans per thousand population of anywhere in the world, and the majority of the funded PET scans are for lung nodules and lung cancer. But these indications are in fact the opposite of the world expert body of opinion, and I can assure you that the impact on patients can not just be profound but even deadly. So let's quickly just look at CT. CTs are something you're familiar with, and a CT scan, for example, shows the exquisite views of anatomy and structure, but almost no ability to determine between a cancer and, say, a scar tissue from a previous infection. So this is a 3-centimeter nodule in the right lung. This is the left lung, the back of the patient in the front. But this nodule has about a 30 to 40% chance of being a lung cancer. Now in Ontario, what they will do is serial CT scans while they wait to see if it gets bigger, and it is a cancer, but it's a little late, isn't it? Let's just look at PET for positron emission tomography briefly. We use a radioactive sugar called fluorodeoxyglucose, or FDG for short. Now, it turns out this is useful because all cells can use glucose, but cancer, it turns out, can only use glucose, and this is very important because they do so very inefficiently, and in general, as you will see, the cancer cells stand out against normal background tissue. This is an FDG PET scan, which is normal. This is the brain showing a lot of sugar utilization, the liver and the spleen here, and in fact we can see in the kidneys here there's some activity, and it turns out unusually this is a sugar that's actually normally secreted into the bladder. But again, let's look at that now, and let's do a PET scan, PET CT scan, and as you can see, there's a lot of sugar uptake here. Now, the chance of it being a cancer is greater than 90%. Doesn't mean it's a cancer, but now it becomes very important to get tissue for diagnosis to make sure it's that or something else. Now, this could be a problem if you're looking for cancer, and we call it a false positive, but in fact, if you're looking for an infection, this actually can be extremely useful. And in the rest of the world, this is how it is used. Here's a patient, for example, who's had an aneurysm of one of the vessels, arteries in their pelvis. They've had a prosthetic graft put in, and they're concerned now it might be infected, and this is the PET scan. Now, see that dark black spot there? That isn't cancer. That's actually white cells fighting that infection. And this is an infected graft, and this is absolutely critical information for this patient. However, you absolutely cannot get a PET scan for this indication in Ontario, and this, I assure you, can routinely lead to being a fatal complication. This infected graft will rupture and they'll bleed to death, but Ontario can't have this test, interestingly. Now, let's look at another example. This is a 16-year-old female with lymphoma in her neck and chest, and this is the CT she had. Heart is in here. Now, these masses up here in the mediastinum or the middle of the chest shouldn't be there. This is the cancer. Let's look at the PET scan. This demonstrates nicely how the cancer cells eat so much more sugar than, say, background tissue like the liver here. The heart is taking up a lot of sugar in this particular case here. Now, normally this patient would go through 6 cycles of toxic drugs to try and treat this cancer, and they would be given another CT scan to see if this is working. But the rest of the world beyond Ontario's borders have known for a very long time that if you do an interim PET scan at around 2 to 4 cycles, if you can demonstrate that the cancer is responding, you can stop it, because it actually becomes more dangerous to the patient to continue the therapy than the actual cancer itself. So here's the patient after 4 cycles. Here's her CT, and maybe the CT mass is a little smaller, but absolutely impossible to determine the critical patient for this patient and her, of course, parents, and that is, does she need 2 more cycles of therapy? On the other hand, look at her PET scan. Absolutely normal here. Does anybody have trouble determining whether or not she needs more therapy? So fine, we stop the therapy. But what next? Because she has the misfortune of living in Ontario, she will be now followed by CAT scans rather than PET scans. And what this will mean is that within 7 to 10 years, we have to start screening her for new cancers of her breasts and thyroid glands. But remember, this is not because of original cancer or treatments. This is because of the gross overexposure to all but useless CT scans to see if her cancer is recurring. Remember, I mentioned about unnecessary investigations and the harm of that, and I assure you that this is absolutely deliberate. Just don't dare to ask the Ontario government physicians to defend their position on that. Now, so far we've just talked about PET-CT in cancer patients, but what about other diseases, particularly the brain and dementia? It turns out that in the 80s, PET was actually being developed because it was the first opportunity to look at the brain functioning. It uses glucose, and of course this is very helpful. And most of what we understand about brain function today comes from PET scanning. This is a modern PET-CT scanner, and these are the exquisite images we're getting. These are the PET images here. This is fused with a CT. So let's look at the major problem we all know is coming with this aging baby boomer population that I'm part of, and the incidence of dementia. In 2008, there was about 564,000 patients. We estimate in the next 15 years there'll be about 937,000 patients. Maybe people remember Robin Williams committing suicide because he had Lewy body dementia. Now, the only way that he could have known that he had this disease, this terrible disease, without an autopsy was from a PET scan. This happens to be a PET scan of a Lewy body dementia. I'll cover that in another topic lecture. Now, you've also may have heard of the plaque we speak about that's again found at autopsy in Alzheimer's patients. This is a normal neuron diagram here, and that's that plaque we speak about. But it turns out, and this is called beta amyloid plaque, we can actually image it. First stage, it was called PIB at the University of Pittsburgh. It was invented. Here's a brain showing a lot of this plaque in an Alzheimer's patient and a normal patient. But the critical message here is that we can actually image this plaque before the patient has symptoms. So the only way we can detect and classify dementias very early and early enough to start any form of therapy, which is absolutely critical, is with a PET scan. However, what's the position of Ontario government experts that I've been challenging? There is no evidence to support the use of PET scanning for brain diseases such as dementia. Ontario patients are the only patients in the world where PET scanning is available that are not allowed to have a scan. And as you will see, your doctor better not demand the government experts explain the unique stance on this PET, or the college will cut them off at the knees. So this is just a hint of what the impact of patients by the Cancer College of Physicians and Surgeons of Ontario gagging your physicians. I'm going to post the ruling itself next, and then I'm going to have a short video talking about some parts of it that are important for you, and also to help you understand whether you also need to fear the College of Physicians and Surgeons. It goes without saying that none of this would have been possible without the deadly silence of these professional journalists, and I can assure you it was deadly for Carol and for patients on a routine basis in Ontario on a daily basis, and of course our most trusted sources of news and information. So this is my website. It's important you do something about this, get it out on social media. The only way we're going to be able to get this message out, in spite of the best efforts of these media people who really are shielding all 3 political parties in Ontario, and yes, the NDP party. And to end this assault on our patients and get access to 2019 levels of care, we need to do something about this. So thanks for listening.